associated with Obamacare, and they don't want to do it. So what you do instead is you say, well, we want to close the coverage gap. And so that's what we're talking about when I was talking about people in the coverage gap. If you say close the coverage gap, those are the magic words to make it not so associated with Obamacare and make it more about being associated with getting people health insurance coverage, getting low-income folks health coverage that they deserve and they need. So that's one issue. The other issue that we have is the money issue. So Medicaid does cost. So it would be an extra $225 million per year for our state to go about expanding Medicaid. But the good news is, y'all, the federal government would pay for most of that. So they'll pay for 90% of the cost of Medicaid and of people moving on to Medicaid expansion. And they've added an extra bonus the federal government has for holdout states like Alabama, Mississippi, and Florida, that they'll give us around $619 million for us to expand our Medicaid program. So if you notice, that number is higher than the one that I just mentioned. So we'd actually be making money back if we expanded our Medicaid program, thanks to this incentive that just passed in the last couple of years. So those are the two things that you'll hear the most often is why we can't do that. So I just want y'all to know that if you ever hear that, tell them, no, we can afford it. There's this incentive from the federal government that will help us pay for Medicaid coverage. So that's no longer a good excuse. I really hope that y'all will get involved in this effort. The biggest thing that we can do right now is Governor Ivey, she actually has authority to expand Medicaid pretty much on her own. So she can do an executive order to tell Medicaid to expand Medicaid to cover this population that's in the coverage gap. And she just has to get a little bit of legislative approval and some budget appropriations later on. But big thing, Governor Ivey can do it. She can get the process started. So we need folks to reach out to her and tell her that this is something that we want to do. So we're going to be doing a call-in day on probably June 21st to the governor's office. It's going to be real easy. It takes 20 seconds, and all you got to do is just call her office and say, we want you to close the healthcare coverage gap. And they'll say, okay. And then you say, okay, bye. But the point of it is, we want to get as many calls in as we can to make sure that she understands that this is something that the people of Alabama want and need and have needed for as long as it has been an option.
So we want to encourage you to think about ways to get involved when it comes to healthcare advocacy in Alabama. One of the best things that you can do is to join Cover Alabama. Hopefully, for those of you who are signing up for the list, you'll get that email. They pretty much, do they autofill the Cover Alabama ones too? They put the script in them? Okay. So, I may be jumping ahead. I'm thinking about a Roberts.
Okay.
Well, hopefully, when you get that email, you'll be able to participate. There will be a script for you. Everyone else will be doing it too, so you'll know that it's not just you.
Oh, the call-in day.
And no one has to just be the most perfect, say everything, get everything out about what we need to close the coverage gap. It's really mostly about you just talking from your heart about why this is important and how this can help people in Alabama. Because helping one of us truly, really does help all of us. There are always other things that are going to be supported, and sometimes when it comes to cost, yes, that may be on the back end. We may spend a little bit in the beginning, but what we have seen from most every state that has expanded Medicaid is that there are definitely benefits that go just beyond someone being able to have health insurance. And just to note, one thing I came across that I didn't put in the slide was out of the 10 states that are considered the worst in healthcare delivery. 7 of those states are states in which Medicaid expansion has not happened. So there are a lot of correlational things there that let us know that expanding Medicaid or closing the coverage gaps is really a very good, sound idea. You touched on like a lot of things as we're coming together that I wanted to talk about with that. Part of this, again, is us really just raising and amplifying the voices of knowing how to get together and talk about what's going on, and supporting that work when people do that. And again, as I mentioned earlier, some people think advocacy is those people that can be seen and go talk, but it's also the people that are writing, what do we want to say for the person that may not be sure what to say. It's also the person that's helping with the logistics. Where are we going to meet it? Who's going to reserve the space? Who's going to volunteer to bring something that's going to help the group keep working, whether it's supplies, whether it's food. So part of doing advocacy is being all on the same page and working together for the same cause. It doesn't have to be anything that's really like great. Like with the group that I was working with, they had to do events in their community. Their churches was a big part of that. They did like a few listening sessions, they did a few focus groups. They also were at health fairs. Some things that they led, some things they were a part of, some things they were invited to. But it helps people also to begin those conversations about what else is needed. Homelessness, or I think I've recently heard it referred to as people who are unsheltered. This is something that is just not an individual issue. This is an intersection of a lot of issues that are going on. Being able to say to people, no, they don't want to be unsheltered. No, they don't want to live on the street or to be at the risk of something happening just because of the change in temperature. Same thing with Medicaid expansion. All those talking points of what people may think that are usually rooted in ideas that are racist or just a lot of thoughts about what something is may not even be factually or even close to factually being true. So we also want to have those conversations to support people into getting out the most relevant, up-to-date, and correct information when it comes to that.
Is the state providing for doctors to get an incentive to move to a rural area so they can help out, even if they have to go back in the Western time and do like a doctor go out and visit, or do a home visit, you know? So is the state putting forth that effort? Is it gonna go through Medicaid or through the Alabama Health
There are
Department?
federal programs that do support physicians that want to work in rural areas. It's called the something training course. I can't think off the top of my head, but there are programs there that do support physicians that want to practice in rural areas. There's also the Institute of Rural Health and Research at the University of Alabama. Their medical school also has a select designation to train doctors to work in rural areas. Because there are a number of trends that you see there. Overall, there is an issue about general practitioners and more physicians are going to go into specialties. So what these kind of programs do is they kind of try to guide those people that may have to be a general practitioner in those areas, they want to work in those areas, or especially if you live here, you're from here, you want to stay here. One of the core issues with that though is that you can't force people to do that. So I would say there are very good bones there when people want to do it. But part of the other issues tie into things like that reimbursement rates. I can't afford to give charity care. So those are the things that create more barriers where we don't see people just flooding to do these kind of programs or flooding to be a part of it. So I know the support is there on the federal side. On the state side, there's always conversations about what can be done. Unfortunately, sometimes those conversations look like one step, two step, versus looking at the bigger picture.
Yes. Hi. Is it possible for the hospitals and health services to be funded by the government? Like, in similar ways that the police are, or firefighters, and what they consider to be those essential workers? And what about establishing universal health care? I figured that one out.
So on the first question, yes, there are federally funded health centers, hospitals do receive funding, which is why they
Tons of
are getting to the right issue. Because the thing about that charity care is, this is after they receive that funding. That's where the issue becomes. So there definitely is an idea of, we work for you, this is your tax dollars at work, but unfortunately the realities of where we're in today does not make that look as appealing or to keep a hospital open. I just think we have a lot of traction that we have to make before they become something that doesn't seem like it's such a at the top of the list ideal.
Yeah.
Because the funding is definitely there for those programs to support moving to the rural areas, for those programs to provide sliding scale paying at federally qualified health centers, or writing off charity care so you don't have to have that loss. But it's again what we see in practice. It sounds great on paper, but what we see in practice is that the needs go far beyond what's the availability to do today. And the question on the universal health care, I don't know if we will see that in our lifetime.
I hope we do.
I hope we do. This is especially true when you balance it out with a lot of different programs that are out there. But that's a conversation that has a lot of things behind it, and unfortunately, both of those things are not things that make people say this is why it's a good idea.
Yeah. Like she said, I don't know. I want to see it in my lifetime. I really hope I do. But for right now, while we're pushing for Medicaid expansion, it's because it is something that's already been done in 40 other states, and it is something that has been proven to help people. Is it going to help as much as universal healthcare access? No, but it's a good step to helping people that we could do potentially right now. So
It's the way to get us there. If we can
yeah.
work to move from the conversation of do we want to do this to the conversation of whether you live or die should not be determined by where you're born, the color of your skin,
Right.
or the gender you were born.
That's right.
So when we shift that conversation, we could probably be in a better place to have those talks to get us there. I'm hopeful.
Yeah.
I'm just also optimistically realistic about what those limitations may be in my lifetime. But that Medicaid expansion is a key component, because the idea behind what Medicaid expansion was before the states had the ability to choose was making sure everyone had access to affordable coverage. So we want to do what we can to keep pushing that idea forward, to keep moving the idea forward, to keep making sure that we are heard into why this is the way on the road to universal health care access. Well, also I want to say I encourage everyone to always know that your voice is powerful, your voice is valid, and never forget to always use your voice to state what the need is.